Hi, good morning once again. This is Dr. Dennis Latuno, and today I'll be talking about lactic acidosis, and also I'm going to give you update in the treatment of systolic congestive heart failure or heart failure with reduced ejection fraction. So, lactic acidosis is the buildup of lactic acid in the bloodstream, mostly due to low oxygen level in the tissue due to either hypoperfusion or some lactic acid are due to drug side effects. If the level of your lactic acid is greater than 2, it's considered positive or elevated. And therefore, you need to investigate what's causing it. There's two types of lactic acidosis, the type A and type B. Type A is due to hyperperfusion, like hypovolemia, where you have like severe GI bleeding, you're having nausea, vomiting, diarrhea, or dehydration. Number two, most common is sepsis due to an overwhelming infection, either from pneumonia, UTI, or bacteremia. And number three is congestive heart failure. Again, if you have CHF, your tissue perfusion is decreased, especially to vital organs like kidney, liver, and lungs. And number four is during cardiorespiratory arrest. Type B is common in diabetics, especially if they're on metformin, which is actually an adverse effect of metformin, and obviously if they're in diabetic ketoacidosis. And number two, alcoholism, again, is by way of thiamine deficiency. Number three, rare causes mitochondrial dysfunction. Number four, in HIV patients, especially if they're taking HIV drugs, which is also an adverse effect from these HIV drugs. Number five is malignancy. And number six is drugs. Again, the HIV drugs, Zybox, which is also known as linezolid. Usually we use this if the patient develop vancomycin resistant infection or in Enterobacter. Number three is propofol, which is anesthesia. And lastly is marijuana. So if you have cases like isolated lactic acidosis without any obvious signs of any infection or heart failure or hypovolemia, you need to do a drug screen, and if they're positive for marijuana, and that's the cause of the lactic acidosis. Marijuana also causes lactic acidosis by way of thiamine deficiency. And then the second topic would be update on treatment of congestive heart failure, especially systolic or reduced ejection fraction. If your ejection fraction is 40% or below, standard treatment right now are combination of beta blocker. You can use either carvedilol or Coreg, metoprolol succinate, or bisoprolol. And number two is the ARNI, angiotensin receptor neprilysin inhibitor. Of course, you can still use the ACE and ARB, but if you're going to use ARNI, or also known also in the trade name Entresto, don't use in combination with ACE inhibitor. It's contraindicated. And number three, you add aldosterone antagonist, which is spironolactone. You start actually at 25 milligram once a day. And then diuretics, you only use them if there's evidence of fluid overload like pulmonary edema or anasarca. All right, thank you very much. This is a short topic, but very important since we encounter this a lot in our clinical practice. Again, thank you very much for following me on my blog and subscribing. Don't forget to like and subscribe again. Thank you for following me again. It's Dr. Latuno. Thank you and God bless.